Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Nutrition and exercise during pregnancy. Introduction. Healthy eating and exercising are important for a healthy pregnancy. This health education program will give you tips on eating and exercising during pregnancy. Eating healthy. The following are 11 tips to help you eat healthy during pregnancy. 1. Eat breakfast every day. If you feel sick to your stomach when you first wake up, choose dry whole wheat or whole grain toast even before you get out of bed. Eat the rest of breakfast, fruit, oatmeal, cereal, milk, yogurt, or other foods later in the morning. 2. Eat high-fiber foods. Whole grain cereals, vegetables, fruits, beans, whole wheat bread, and brown rice can prevent constipation. Drinking plenty of water and daily physical activity can also help. 3. Keep healthy foods on hand. A bowl of apples, bananas, peaches, oranges, and grapes makes it easy to grab a healthy snack. Fresh, frozen, and canned fruits and vegetables make healthy and quick additions to meals, as do canned beans. 4. If you have heartburn during pregnancy, eat small meals more often. Also, eat slowly, avoid spicy and fatty foods such as hot peppers or fried chicken, drink beverages between instead of with meals, and do not lie down right after eating. 5. If you have morning sickness, hyperemesis, talk with your healthcare provider. You may need to adjust the way you eat and drink, such as by eating smaller meals more frequently and drinking plenty of fluids. Your healthcare provider can help you deal with morning sickness while keeping your healthy eating habits on track. 6. Certain foods and beverages can harm your baby if you eat and drink them while you're pregnant. Ask your healthcare provider for a complete list of foods and beverages to avoid. Generally, you should not consume alcohol. Instead of wine, beer, or liquor, drink apple cider, tomato juice, sparkling water, or other non-alcoholic beverages. 7. You should not eat fish that may have high levels of mercury. Do not eat shark, swordfish, king mackerel, and tilefish during pregnancy. Eat no more than 12 ounces of any fish per week. 8. You should not eat soft cheeses such as feta, brie, and goat cheese and ready-to-eat meats, including lunch meats, hot dogs, and deli meats. These foods may contain bacteria called listeria that are harmful to unborn babies. Cooking hot dogs, lunch, and deli meats until steaming hot can kill the bacteria and make these meats safe to eat. 9. You should not eat raw fish such as sushi, sashimi, or ceviche, and raw or undercooked meat and poultry. These foods can contain harmful bacteria. Cook fish, meat, and poultry thoroughly before eating. 10. You should not drink large amounts of caffeine-containing beverages. If you drink lots of coffee, tea, or soda, check with your healthcare provider about cutting back on caffeine. Instead, try decaffeinated versions of your favorite beverages, or warm, low-fat or fat-free milk, or sparkling mineral water. 11. Sometimes pregnant women crave something that is not food, such as laundry starch or clay. Talk to your healthcare providers if you have such a craving. Healthy food choices like fruits, vegetables, whole grain breads and pastas, non-fat or low-fat milk products, and low-fat protein sources such as lean red meat, poultry without the skin, and beans will help your body do a good job of keeping both you and your baby healthy. You should also take a prenatal vitamin that contains folic acid every day. Talk to your doctor about how much folic acid to take and how to ensure your diet meets the nutritional needs of pregnancy. Exercising. Almost all women can and should be physically active during pregnancy. First, talk to your healthcare provider, particularly if you have high blood pressure, diabetes, anemia, bleeding, or other disorders, or if you are obese or underweight. Whether or not you were active before you were pregnant, ask your doctor about a safe level of exercise for you. Aim for at least 30 minutes of moderate intensity physical activity on most, if not every, day of the week. Moderate physical activity during pregnancy 1. Helps you and your baby gain proper amounts of weight. 2. Reduces the discomforts of pregnancy, such as backaches, leg cramps, constipation, bloating, and swelling. 3. Lowers the risk of gestational diabetes. 4. Boosts mood and energy level. 5. Improves sleep. 6. Helps with an easier, shorter labor. 7. Assists faster recovery from delivery and return to a healthy weight. The following are the 5 steps for safe exercise during pregnancy. 1. Choose moderate activities unlikely to injure, such as walking, water aerobics, swimming, yoga, or using a stationary bike. 2. Stop exercising when you start to feel tired and never exercise until you are exhausted or overheated. 3. Drink plenty of water. 4. Wear comfortable clothing that fits well and supports and protects your breasts. 5. Stop exercising if you feel dizzy, become short of breath, feel pain in your back, experience swelling or numbness, feel sick to your stomach, or your heart beats too fast or at an uneven rate. Here are some tips to start on an exercise program. 1. Go for a walk around the block or through a shopping mall with your spouse or a friend. 2. Join a prenatal yoga, water aerobic, or fitness class and let the instructor know you are pregnant before beginning. 3. Follow an exercise video for pregnant women. 4. At your gym, community center, YMCA, or YWCA, sign up for a fitness session for pregnant women. 5. Stand up, stretch, and move at least once an hour if you sit most of the day, as well as during commercials when watching TV. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Things to avoid. For you and your baby's health and safety, it is best to avoid the following during your pregnancy. 1. Being active outside during hot weather. 2. Steam rooms, hot tubs, and saunas. 3. Certain yoga poses or other activities that call for lying flat on your back after the 20th week of pregnancy. 4. Contact sports such as football and boxing that might injure you. 5. Sports like tennis or basketball that make you jump or change directions quickly. 6. Horseback riding, inline skating, downhill skiing, and other activities that can result in falls. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Even before you become pregnant, exercising and good nutrition are important to your well-being. However, as you become pregnant, you have to do some changes in your eating and exercising habits to accommodate pregnancy. Eating high-fiber foods like fruits and vegetables is a great start. If you have heartburn or morning sickness, try eating smaller meals more often. Don't skip breakfast. As a pregnant woman, you need more of certain vitamins, minerals, and proteins, including calcium, folic acid, and iron. You need to rest and try not to overdo it. While you are pregnant, you might not be able to do everything you did before you became pregnant. If you already have a healthy diet, you might only need to make a few adjustments to ensure you are receiving everything you need during pregnancy. Talk to your doctor to make sure you are getting everything you need for a healthy pregnancy. Thank you for using Explain.